Hi, and welcome back to the Elder Law Question and Answer series. My name is Michael Rose, and I'm really excited today because we're talking more about in-home care. And I have Jody Classen with me. She is a registered nurse. She's the Director of Professional Services for First Call Home Health Care. And so welcome. Thank you so much for coming today, Jody. I'm really excited to talk to you more about home health care because this is a fast-growing industry here in this area, as well as I would imagine across the country.
Absolutely.
There's a lot of people who are needing in-home care.
Yes.
And so specifically we're talking about what registered nurses do today. We want to talk about what it takes, first of all, what it takes to receive or qualify to receive home health care services.
Sure, there are a couple things that need to happen. First, you need an order from your physician. So once that happens, they give the referral to the home health department and they process it. There has to be a skilled need for the services. So whether that's for nursing or therapy, that's determined by the physician. You have to have the approval of your insurance as well. And lastly, the agency has to be Medicare certified.
Okay, so the agency such as like your agency, for instance, they would need to be certified to work with Medicare.
Correct, yes.
Okay. And I understand there's this, as you said, a homebound status. What does it mean to be homebound?
Sure. Okay. So homebound status, there has to be a taxing effort for the patient to leave the home, and that varies by patient. But generally, if they go out to see the doctor, that's part of the health services. That's not a problem.
Okay.
It's conditions where they get too short of breath or just aren't able to ambulate and walk that far.
Okay, so it's not necessarily that they're strapped down in their bed and they can never leave, but it's more that it takes a lot of effort for this person to leave their home. So we don't want to make them go somewhere else for therapy, but somebody else can come in and do that for them in their home.
Absolutely. That's where home health comes in place.
And just to backtrack a little bit, you said that it does have to be a referral from a doctor.
Absolutely.
Okay.
Yes. That's how it starts.
Okay. So what are some examples of why you can leave your home and still be considered homebound then? Oh. Like, is it just anything? I know you said maybe go to the doctor, but can they still go to church, for example?
They can. You can go out for infrequent outings.
Okay.
To church, appointments, special occasions with the family, holidays, things like that are okay.
Okay.
It's when it becomes a frequent outing, say to get your hair done or nails done, something that's not medically necessary. That's when you no longer become homebound.
That's when the insurance cuts it off.
Correct. Yeah.
Okay. All right. So what types of services can the nurses provide?
Nurses can provide wound care, catheter care, injections, teaching on so many different things. Chronic illnesses, including CHF, diabetes, COPD, chronic obstructive pulmonary disease, several of those chronic diagnoses. We can also do teaching on more short-term acute illnesses like pneumonia, prevention of urinary tract infections. There's a lot of things that we can help with.
Well, so it sounds to me like a lot of what you do is instructing probably the patient, probably I would assume maybe family members too.
Yes, we do a lot of teaching to the family.
Okay.
And showing them how to do things as well for wound care, because we do a lot of skills as well.
Okay.
Yeah, not just teaching, but that's one of the things that we can do.
Okay, interesting. So how frequently do the nurses actually visit a patient in their home?
That really depends on that first nursing assessment. When they come out to see the patient, they assess them and their care needs and see exactly what's needed. So some patients might not need to be seen once a month. Some others are seen on a daily basis. Just depends on what their needs are. And it varies. The visit can vary between 30 to 60 minutes, again, depending on what's needed.
Okay. Yeah. And do home health care agencies such as yours, do they provide services after hours?
Yes, most home health agencies do.
Okay.
They have an on-call nurse typically who can make visits or give advice over the phone.
Okay, and what happens if somebody needs to go to the hospital?
We usually send patients to the hospital because home health is not an emergent care.
Okay.
We send patients there, and then we follow up with the hospital the next business day and coordinate care for a smooth transition back home if they're admitted.
Okay. Great. Thank you so much, Jody. We're out of time, but I know we'll have a lot more questions for you. So hopefully you'll want to come back and sit down and chat with us again.
Of course. Thank you.
Great. Thank you so
Okay,
much.
you're welcome.